Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here once again to give you an update on the COVID-19 pandemic in the States, in Baltimore, in our region, and at GBMC. And we'll also talk a bit about monkeypox. So what about the pandemic? Well, today we have 599 Marylanders who are in our hospitals who are positive for COVID-19. Only 66 of them are in intensive care units, showing that the BA Omicron variant is very contagious, but it is not creating a lot of serious illness. And why is that? Well, it's probably because Maryland has done a pretty good job with getting people immunized, and many of us, now including me, have had the disease and therefore created some antibodies to this variant or a previous variant. I got sick about 6 weeks ago, and I had a sore throat, runny nose, and was feeling kind of down for about 72 hours. I stayed isolated from my family members until I had gone out of the infectious state and tested negative. And now I'm pretty much back to normal. And I think my experience is about average now for people who get COVID-19. And once again, the reason for that is because we have gotten immunized, and also we've gotten some protection from previous bouts with the virus. Please get boosted if you are due for a boost. And please get your children vaccinated. The statistics are starting to look much better about children of school age, and now we have the ability to get younger children immunized as well. So please get your children immunized. So today at GBMC, we have 13 people who have tested positive for COVID-19 as patients. None of them are in the intensive care unit. Interestingly, 5 of the 13 are clearly in the hospital for other reasons. Either they're rehabbing or they're here to deliver a baby. So once again, we see evidence locally that this virus is contagious, but is not creating a lot of serious illness in our community. How about monkeypox? Let's spend just a moment on that. Monkeypox is also caused by a virus, and it's a virus that is in the same family as smallpox. Now, it has been decades since the United States vaccinated people against smallpox. It's a disease that we don't see anymore, but it does appear that smallpox vaccination in elders may be presenting some degree of protection. The virus itself is not highly contagious the way COVID-19 is. The monkeypox virus requires human-to-human contact, physical touching, skin rubbing against skin, people touching the pox lesion, people kissing people that have monkeypox. So there's no reason to be anxious about being out and about, doing your usual day chores and going to the supermarket. You're not going to get monkeypox from walking in the same area as somebody who has monkeypox. It's very different from COVID-19. Obviously, if you come across an individual who has a rash suspicious of monkeypox, advocate for them to contact their healthcare provider don't touch the rash, and you should be fine. Wash your hands frequently. That's always good advice. The numbers of cases being reported in the United States of America are now in the hundreds across the whole country daily, as opposed to COVID, which is in the thousands and has been for quite some time. So how about vaccination against monkeypox? Well, there is vaccine, but it's in very, very short supply. And the CDC is only recommending that doses that we have be given to people who are at high risk, people who have been in direct contact with people who already have the disease, especially those people who are already immunocompromised. So stay tuned. If we do contact tracing and isolate people that have monkeypox, we should be able to put an end to these outbreaks. Let's cycle back to talk about contact tracing. There was great hope that contact tracing was going to be very effective with COVID-19. It turned out not to be very effective, and the reason is that COVID-19 is so highly contagious, and an infected person was spreading to many, many people before anyone even knew that the infected person had the disease. That is not the case with monkeypox. Once we have what's called an index case of monkeypox, it should be pretty easy for the contact tracing to quickly identify the people that that person has had close contact with. Anyway, let me go back and thank healthcare workers for continuing to stand up against COVID-19. Let me thank all the public health officials who have worked diligently to get us to the point that we are at with COVID-19. Please wear your mask if you're at all concerned. Please wash your hands frequently. If you need us, we are here to care for you at GBMC. Thank you.